Hello, I'm Dr. Doran, local medical director here for the Central Region in the Southwestern Ontario Regional Base Hospital Program. Just making a video from the base hospital just to wish everyone a very, very, very happy Paramedic Services Week. You guys do so much work for us out there and you do some great job for all of our patients and their families, and the work that you do is extremely important and extremely valuable, and we just want to take the time to remind you of that and to say thank you and happy Paramedic Services Week. I believe now we have an Ask Mac question. So this year we thought that we would take some real-time Ask Mac questions and then basically have the local medical directors respond to them during this video, just out of interest sake, and answer some questions that have popped up over the last little while.
When treating a patient for acute cardiogenic pulmonary edema with nitroglycerin, is it true that we can consider a fluid bolus if the patient becomes hypotensive, even though they have crackles in their lung fields on auscultation?
So that's a really good question. I guess there's a few things to answer to this. Basically, paramedics are able to administer a fluid bolus even though the patient may be experiencing some crackles in this setting. However, it is important to remember that we bolus the patient until they're no longer hypotensive, but any more nitroglycerin should be withheld. And then if we wanted to talk a little bit about the mechanism of action in nitroglycerin in these scenarios, essentially nitroglycerin is converted to nitric oxide in the body, which then sort of initiates a series of enzyme cascades that ultimately leads to sort of vascular effects, and basically you end up with, at lower doses, venodilation, which reduces the preload on the heart, and at higher doses you'll end up with some arteriolar dilation, which reduces some of the afterload and the patient's blood pressure, thereby improving the blood flow through and reducing the amount of strain that's on the heart itself. So hopefully that answers the questions that we were looking at today. As always, please feel free to reach out to us here at SWORBHP, and if you have any further questions or points of clarification, we're happy to answer them at any time. And once again, happy Paramedic Services Week. Thank you.